How are you? I'm here today to let you know which book I studied for my FCPS Part II examination throughout the residency. And initially I was not at all guided, which book to study, as I told you in my previous lecture that how to prepare for your FCPS Part II examination. And so that is my experience, and I'm telling you that if you follow these books, I think they are the best books that I've gone through, and it will help you a lot, like it helped me in passing my exam, right? So first of all, the most important book is Current Medical Diagnosis and Treatment, and that is here. Just look at it. Okay, latest edition you have to buy. The year that you are preparing for your examination, and it should be the latest edition, right? So nobody told me, even after 5 or 6 months of my initial residency, I came to know about this book. So it is very good, concise, and you can remember each and everything from this book. But you have to take the latest edition when you are appearing in your viva or examination. You have to take the latest edition and latest information about each and every disease, the treatment, what are the advances, and everything you should know. Okay, so whichever case you are given, you should have a thorough knowledge of this, latest thorough knowledge. Okay, so this is the most important book. If you study from this book, you will pass, inshallah. And most important book for physical examination, clinical examination, I had studied Hutchinson's clinical method throughout my undergraduate years. So if you change the book, it's better. So I found this very good, helpful, and this is the clinical examination, a systemic guide to physical diagnosis by Nicholas J. Talley. It's a very good book, and you can have excellent knowledge out of this book. And it's my advice that you should follow one book only, right? So, and book to be consulted while doing your emergency duties. When I was doing my residency, this iPhone was not available for me, right? So now you have the opportunity to download each and every book in this. How difficult it was to carry this book, Current, or now I have each and every book downloaded in my iPhone, or if you have Android phone, download the books, latest edition, like Harrison or Current or whatever book you can find. So you can easily, you can take the reference. But the book which I always carried with me while doing my emergency duty was Washington Manual. This book, right? This is Washington Manual of Medical Therapeutics, and so you can easily go through it while you are taking care of the patients while doing emergency. That's a very good book. Now you can have each and everything in your mobile phones. Now, books for your theory preparation. The first book which I will recommend is Rapid Review of Clinical Medicine by Sanjay Sharma. It's a very good book, and many cases are given in it. I don't know, this was the book when I used to study, but I think it should be more voluminous now. I don't know. And the other book which I cannot find in my shelf, I don't know, I have lost it or what, those were the MRCP cases, just like that. And they were excellent, a small book with MRCP cases. I went through this and those MRCP cases, and I passed my theory exam. Okay, so you can do that. Plus you have to prepare from the past FCPS II papers, whatever. I used to write that I have been discussing with you now, and in my own writing I can recall it very easily. So writing is very important. If you write your notes, small notes from your books, it's very, very helpful. So past papers you have to do, okay? And other is MCQ books. There are thousands of MCQ books, you know, in clinical medicine, but I don't remember studying from MCQ books. Really, I don't remember that. Did I do it or not? I think I didn't do any of the MCQ books. Can you imagine? All right. Then for long cases, you know, the book which was excellent and found it fortunately, but unfortunately I had given to one of my colleagues and he never returned to me because he didn't appear in the examination when I was doing, when I was appearing. So later I gave him and he never returned. So I don't know whether you can find it in the market. It is Long Cases by Nicholas J. Talley. Excellent cases he has described, and really if you read from there with your knowledge from current, you will pass the exam very easily, inshallah ta'ala. And for talks, you know, all these books help you to pass in talks. I don't think that you will find any difficulty. So it's my advice. It's what I followed and I passed, so that I'm telling you. I don't know if the new books have arrived and you people are studying from that. And at the end, I would like to one thing I forgot, for short cases, what you have to do in short cases. This book, excellent, R.R. Bellica. It has got small, very nicely written short cases, and you can pass from it. This book, surely, definitely, inshallah. And above all, so these are the books that you have to study, and one book, you know, this one. Let me see. This Harrison Principles of Internal Medicine. This is the ultimate book of medicine, and I find it so enjoyable. Excellent book, but I don't think that this can be studied while we are doing residency. Tough job, you know. So you can take references from this, because I studied few topics that were not clear in current. So I always had this book, but this book will be your companion after you pass FCPS II, inshallah. Because you won't like any book if you study from Harrison. So you can take references, you can study some topics, like I studied a few topics from Harrison while doing my residency. Okay, I think this is all that you can study throughout your residency, but the most important thing is that the patients are open books. You have to examine the patient, you have to take history in detail, you should correlate all the symptoms, and you should follow up your case every day, and you should, you concentrate that what has happened in each patient when that patient is admitted, and what you thought and what the final diagnosis has become. So you should know each and every step that you have taken to diagnose the patient and treat the patient appropriately, you know. So it is the most helpful thing that you are doing while doing your residency. So never shun your duties, never be late in your ward. So everything, every day counts in your residency. All right. Okay, I think I've told you enough. So I think I should take leave. All right. Thank you so much. Wish you best of luck. Please tell me, give me comments. All right. I'm always happy to read your comments. Thank you so much. Okay. Khuda Hafiz. Khuda Hafiz.